So Professor Saarma, thank you so much for your time this morning. I wondered, could I ask by asking you a very general question, which is, what are growth factors?
Growth factors are proteins. They were discovered more than 50 years ago, and for that discovery, Rita Levi-Montalcini and Dr. Cohen got the Nobel Prize. So these are proteins which are secreted by the cells, and then they influence the same cell. They were secreted or other cells, and most commonly they stimulate the proliferation of the cells, meaning that if you have one cell, this growth factor stimulates that this one cell divides and you get two cells, and then two cells give rise to 4 cells. But neurons or nerve cells, as you know, do not divide. They are, we call them post-mitotic cells, or cells which don't divide. So for neurons, growth factors have one main function. They keep neurons alive. They signal to the cells, don't die. Because, you know, nerve cells in our body are usually as old as we are. In my brain, most of the neurons are 70 years old. And they are not alive like that. They need constant signal from the growth factor. Stay alive, stay alive, stay alive. So growth factors keep neurons alive.
Thank you, Professor Saarma. That was really helpful. I was wondering if you could tell us a bit more about the growth factor CDNF specifically.
Yes. So CDNF comes from the cerebral dopamine neurotrophic factor. So the name tells that this factor has something to do with the neurons, and indeed, my laboratory discovered that growth factor now 12 years ago, and we were able to demonstrate that our growth factor, we named it CDNF, is able to keep alive neurons which are dying and degenerating in Parkinson's disease. We call these neurons dopamine neurons. So CDNF is a protein which can protect, and not only protect, but also regenerate dopamine neurons. So from the very beginning, because in the test tube, they kept dopamine neurons alive. In mouse and rat models of Parkinson's disease, they stopped neurodegeneration and kept dopamine neurons alive. And then also in monkey experiments, it did the same. We thought this is a great protein which should be tested in patients with Parkinson's disease because they keep dopamine neurons alive.
Thank you, Professor Saarma. And we've heard a lot about another growth factor called GDNF in Parkinson's. How does CDNF compare to GDNF?
So they have some common properties. GDNF, like CDNF, is also able to protect and regenerate dopamine neurons, but they are completely different how they do that. GDNF is a protein which is secreted by the cell, and then it binds to the receptor. Receptors are like antennas on the surface of the cell, which receive the signal or bind the growth factor. And when growth factor binds to that antenna, it sends a signal to the cells: don't die, stay alive. So GDNF does the work like that. Our growth factor, CDNF, is doing it in 2 different ways. It mostly acts inside the cells. It's mostly an intracellular protein. it is residing in the area of the cell which is responsible for producing proteins, the endoplasmatic reticulum. And it is involved in the regulation that all the proteins which a cell is making are done well. It's like a quality control. So our protein, when the cell is making proteins which are aggregating or forming fibrils, like we have in Parkinson's disease, there is a protein called alpha-synuclein, which is part of these Lewy bodies. These protein aggregates are eventually killing dopamine neurons. So our protein affects on those aggregated proteins, reduces their amount, and through that saves dopamine neurons. It also acts like CDNF. It also can be secreted and bind to its own antenna and also send a stay alive signal to the neuron. But it has a broader spectrum of action compared to CDNF. We have actually compared the GDNF and CDNF in a very thorough study. And we have actually found that when we compare them side by side, CDNF was more efficient in preventing the death of dopamine neurons and also regenerating the dopamine neurons and also improving the motor behavior of the animals.
Thank you so much. That was incredibly helpful. I gather that you've been looking at and exploring very small versions of CDNF. And I wonder if you could explain a little bit about that and as to why this would be an advantageous approach.
So, as you know, the pioneering work done by Dr. Stephen Gill in United Kingdom using GDNF and to deliver GDNF into the Parkinson's patients has recently produced, in my opinion, very, very encouraging results. A company called Mart Saarma that I started together with my colleagues in Finland recently tested CDNF, our protein, also in Parkinson's patients, with also very promising results. So looks like everything is quite nice. However, we should admit that in both Dr. Gill's study and in our study, we had to deliver our proteins directly into the brain of the patients. And that means that every patient underwent a rather complicated and perhaps risky brain surgery. So we were looking very much, is it possible to develop a strategy that these valuable proteins can be delivered to the patient so that no brain surgery is needed? And it is quite interesting, some 10 years ago when we were purifying biochemically our protein, CDNF, we noticed that during the purification, protein is cleaved or cut like with scissors and cut in one place. And later we realized that when we solved the structure of our protein, that our protein consists of two parts. The bigger part, about 100 amino acids, and the smaller part, like we call them domains, or if you wish, two fists. And they are joined, these two parts, by amino acid sequence. And the scissors cut in between these domains. And I got interested to find out whether these smaller parts of the protein, which we accidentally got, are biologically active. And it turned out that the smaller part was fully biologically active. And what is more, I noticed that this smaller part is able to penetrate the cell membrane, enter the cells. And then together with my colleague, Merja Voutilainen, we immediately tested, could it be passing the so-called blood-brain barrier? As you know, in mammals and in humans, we have a blood-brain barrier. If you inject something into the bloodstream or into the subcutaneously or take into the mouse, most of these substances are not going into the brain because there is a barrier. This barrier protects our brain from toxins and from unwanted substances. But in our case, we would like to get our brain into the, our substance into the brain. And we notice that this small fragment of CDNF can pass through the blood-brain barrier and enter the brain. This was, of course, wonderful. We were very, very excited. But now the question is, does it work? That would mean that we don't need now the brain surgery. We could inject the protein into the bloodstream or inject into the some other into the muscle or subcutaneously, and wait whether this would help. So if it would work, it would allow to avoid intracranial surgery. Second, currently with the intracranial or brain surgery, we cannot treat early stage patients. Ethical committees don't give us permission. We can treat only middle or late stage patients. And middle or late stage patients, they have lost already a lot of dopamine neurons. Now, when we could deliver in a non-invasive way, we could start treatment immediately after the diagnosis because subcutaneous injection is not risky. And third, and perhaps also very, very important, Parkinson's disease has also, in addition to these motor symptoms, many other symptoms. We call them non-motor symptoms. Well, the most important non-motor symptoms are depression, constipation, lack of motivation, sleep disorders, pain, and cognitive decline in the later stage of the disease. And these are not treated almost at all in Parkinson's patients. Now, delivering the substance peripherally or systemically or into the bloodstream could perhaps help us with some of the non-motor symptoms. We wanted to know what happens to the dopamine neurons in the mouse which does not have our factor. And surprise, 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 these mice develop constipation. Then one of the most important non-motor symptoms of Parkinson's disease. What happens to these mice? Their dopamine neurons in the gastrointestinal tract, which are responsible for the gut motility, are degenerating. So now, giving CDNF in the periphery, perhaps we could help also with constipation. So I think this is what we think about the possible advantages of the CDNF fragment. Of course, we are still in the preclinical phase. We are testing it in the animal models. We see the effects that peripheral delivery or systemic delivery of the CDNF fragment works. We see improvement in the motor behavior, but we want to improve our compounds. The fragments what we have need improvement, and that's what we are working on now.
Thank you so much. And you've kind of alluded to this, but I was wondering, where is your work at the moment, and how soon do you see it reaching the clinic?
So we at the University of Helsinki, where I'm working in Finland, has recently licensed the CDNF fragment technology to the Herantis company. So in the in the close collaboration with the CPT and also in the close collaboration with the Herantis company, we are trying to take these fragments into the clinical trial. But as I said, we are still in the stage of improving the compounds, still trying to improve their efficacy, stability, the blood-brain barrier penetration. So, but I think we know what we need to do. And I'm optimistic. We were able to take CDNF into the clinical trial. I'm quite sure that in this particular case, Herantis Pharma is able to take the CDNF into the CDNF fragment into the clinical trial. It's a little bit too early to say, does it take, how many years does it take? Because usually these prognoses are very hard to predict.
Professor Saarma, thank you so much. I have to say we are incredibly pleased to be supporting your work in looking at these small fragment CDNF as to how we can further progress these further and move these towards the clinic. Because as you say, if it means that we have a solution that does not involve surgery and is less invasive, and we can treat patients at an earlier stage in the disease, this would seem to be a hugely positive step forward. Thank you so much for sharing a small insight into your brilliant work.
And from my side, I'm of course very grateful for your foundation, that you are supporting our work, and I really hope that we can make a significant progress, and maybe in 5 years or so we can already think of testing the patients.
Let's try and make it a bit less than 5 years.
I give a very pessimistic view and hope that it could be twice quicker.
Fantastic. Thank you, Mart. That was absolutely brilliant.